Hello, welcome to the Chronic Disease Self-Management video channel. My name is Cari Waller and I will be helping facilitate these videos over the next few sessions. Like all of you, we are here because we either have a chronic health condition or we are close with someone who does. We believe in this program, so we took a training through Stanford University to become facilitators of these sessions. For starters, let's remember that most of the time we spend dealing with our health condition is not spent in the doctor's office, but in our everyday lives. How we live every day affects our symptoms, our health, and our quality of life. This video channel is designed to give us some of the self-management tools needed and to help us become more active self-managers. As a result, we can greatly improve our lives. For this video channel, we will be using our self-management toolbox. Our self-management toolbox contains the different topics we will cover over the video channel. In this video channel, we will discuss physical activity, medications, decision-making, action planning, breathing techniques, understanding your emotions, problem-solving, using your mind, sleep, communication, healing, weight management, and working with health professionals. We have all heard about the connection between the mind and the body and how the mind influences our bodies. In this segment, we are going to look more closely at this relationship as we explore ways to manage our health problems and the symptoms that we experience. In this video, we're going to focus on short-term distractions to help us manage our symptoms. To begin with short-term distractions, it is important to know that our mind is like the radio. It's difficult to focus on two channels at the same time. The radio, though it receives many stations, can only play one station well at a time. This is also true of our minds. We only focus well on one thought at a time. Therefore, learning how to use distractions can be beneficial for managing pain and other symptoms. Short-term distractions can also help us when we have troubling thoughts, difficulty sleeping, or getting back to sleep after waking up during the night when we experience shortness of breath. Because our mind doesn't focus well on two things at the same time, we force our minds to think about something rather than our symptom, so the symptom will feel less intense. Some examples of short-term distraction techniques are counting backwards by 3, playing a sports game in your head, thinking of a flower or bird for each letter of the alphabet, making plans for a future event, or trying to think of all the words to a song. For short-term distraction to take effect, all of these are done only in your mind. A good pointer when using distraction is to remember that thoughts are best for short periods, whereas engaging in physical activities that provide diversion can work for longer periods. When you engage in an interesting activity such as going to the movies, gardening, reading, you forget about your symptoms. However, sometimes you need to interrupt a long, distracting activity so as not to overdo and cause more pain and fatigue later. Warning: do not practice distractions or ignore a symptom when you are experiencing chest pain, numbness, or darkness on one side of your body. For emergencies, always remember to use your lifeline or call 911. Getting quality sleep on a regular basis can also help us manage our symptoms. When we sleep, our bodies secrete hormones that help the body heal by repairing the wear and tear that has naturally occurred during the day. Getting good quality sleep is especially important for people with chronic physical and mental health conditions because it helps the body and the mind recover. The amount of sleep needed in a night is different for everyone, and getting a good night's sleep can sometimes be easier said than done. Having difficulty sleeping is not an uncommon complaint. Here are some ways that you can use to get a good night's sleep. Go to bed at the same time every night. Get up at the same time each morning, even on the weekends. Avoid caffeine, including chocolate, 4 hours before bed. Avoid alcohol before bed. If you are a light sleeper, use earplugs. If you tend to wake up in the middle of the night and have problems falling back to sleep, this may be caused by anxiety or depression. Sometimes you can fall back to sleep by keeping your mind away from your troubles. This is a time when you want to practice distraction, similar to what we used in the previous segment. If your sleep problems continue or you're concerned about getting enough sleep, please talk with your primary healthcare provider. Sometimes it can be overwhelming to think about the changes we want to make or the activities we want or need to accomplish. They seem like too much to work on all at once, and it makes it harder to get started. To help with this, we have one of the most important self-management tools in our toolbox, action planning. Action plans allow us to achieve what we want or to decide what to do by breaking down the activities into smaller steps. For example, if you would like to improve your fitness level by doing exercise, one plan could be to research what type of exercise would be appropriate for you. Another plan could be to find a place that you're able to exercise near your neighborhood, or you could ask a friend to exercise with you. Remember, always speak to your healthcare provider before starting any exercise plan. How to create your action plan. Here are some simple tips in how you can start creating your own action plans for a healthy habit you would like to start. Number 1, think or write down something you want or decide to do. Remember, this is something that you want to do, not something that someone else wants you to do. Number 2, be action specific. For example, losing weight is not an action. Rather, make your goal going to the gym, walking around the block, replacing snacks with fruits and vegetables. Number 3, answer the questions. What specific action would you like to do? For example, replacing junk food snacks for healthy snacks, setting a timer to remind you to go to sleep, or a timer to take your medication, or any other action that will help you reach your goal. When do you want to do these actions? What time of day works best for you? If it's exercise, you can say exercise 30 minutes a day or walk 4 blocks after work. Remember, always use actions. How often are you willing to repeat the actions that you have committed to? Always remember to discuss major health decisions with your primary care provider and with the health coordinator at your work site. I bet they have some great advice. Thank you for joining us for these first sessions. Stay tuned for further sessions on how to improve your health. Thank you.